Welcome to today's plenary session, a hot topic, climate and nursing. Dr. Barbara Sattler is a professor at the University of San Francisco and international leader in environmental health and nursing. She is a founding and active member of the Alliance of Nurses for Health Environments, an international organization that is helping to integrate environmental health into nursing education, practice, research, and policy advocacy. While at the University of Maryland, she directed the Maryland Hospitals for Health Environments, a 10-year statewide initiative that helped hospitals develop sustainable policies and practices to achieve the triple bottom line for employee health, patient health, and ecological health. Dr. Sattler has worked at the local, national, and international level to improve nurses' capacity to address environmental policy. She is the author of Environmental Health and Nursing and many peer-reviewed articles. Dr. Sattler is a registered nurse with a master's and doctoral degree in public health from Johns Hopkins School of Public Health. She is a fellow in the American Academy of Nursing. Ladies and gentlemen, please join me in welcoming our speaker, Dr. Barbara Sattler.
Good morning. I have my water bottle, no plastic. I can't actually see you because of the lights, but I think there are a few of you out there, and I am so delighted to be here with you. I was told just a few minutes ago that many of you as nursing students and perhaps even nursing faculty are interested in understanding how climate change relates to nursing, but haven't actually learned about that. So I'm hoping an hour from now, you will be able to say, I really do understand why this is important to nursing, and you will be able to use your voices on these issues and, in fact, take action. So I am going to begin. So some of you may know a little tiny bit about the science. I'm only going to spend a couple of minutes on it. But basically, in our atmosphere, the sun rays heat up the Earth, and historically, much of that heat has been able to be reflected off and out beyond the atmosphere. So we've been able to keep the Earth at a temperature that is supportive of all life, including humans, but our whole ecosystem. But what has happened in the last 50 years or so is that we have been creating more and more of these types of gases that we call greenhouse gases that are creating a blanket around the Earth. How many of you have ever gone in shopping, left your car in the parking lot on a really hot day with the windows closed, and got back in the car and it was like so much hotter than outside? Well, what was happening there was the heat was coming in, the sun rays were heating up, but there wasn't a way for that heat to actually release from the car. Well, that's what's happening on Earth right now. And if you see this sort of white area in the atmosphere, this is an area where greenhouse gases have accumulated. And they're creating this blanket that when the sun rays are heating up the Earth, they're not able to as effectively reflect off and out. So we are living in the equivalent of this greenhouse right now, and that's why they call it a greenhouse effect. That it's these gases that are creating this capacity where the heat can't leave the Earth as well as it used to. And as a function of this, what we're beginning to see is the Earth is slowly warming up. So where are these greenhouse gases coming from? I'm not going to spend a lot of time on this, except for you to know they're coming from us, from the ways in which we live and transport ourselves, from the ways in which we use energy, extract it from the Earth, and also from agriculture, so from lots of different places. And so that means we have lots of different opportunities for improvement. And I'm going to talk, when I get to solutions, I'm going to talk about what are the ways that we as nurses can really engage in the solutions. So when we have the Earth warming up and this global warming, this creates changes in our climate. And I'd like to quickly distinguish between weather, which is what happens from day to day, and the weather is what you worry about if you're going to plan a picnic or a wedding, and the climate, which is a more averaged, general sense of the temperature over time. And what we are seeing is that the temperature on Earth is increasing. And as it does that, it's not just affecting the overall climate rather, but we're also seeing these changes in weather that are showing up in these extreme weather events. And I'll talk a little bit more about those and what that means to us. So think about this, and I was thinking about how to best explain it. So you all know 98.6 is normal temperature, right? A couple of degrees difference in a human body, 100.4 constitutes a fever. And we all know that as soon as people get feverish, things start to go awry. You certainly don't feel good, but also, once that temperature gets higher, we can start to see permanent tissue damage in the human body. If it stays hot for too long, we can see brain damage. We can see the kidneys shut down. So just a few degrees are really important for our health. But it's also a big question, what happens if everybody's temperatures start to rise? Well, the truth is that all of the animals, all of the sea creatures, all of our plants, including the plants that we eat, they require temperature to be in a certain range. They also require sun and water and fertilizers and food and all of those other things. But temperature is important to life, not just to human life, but to all life, and the ways in which we are all interconnected. And what we're beginning to see is that the temperatures rise, and as the oceans rise, which are really important, and I'm not going to get into that, but the temperatures of the ocean are really important to climate and weather patterns. As we see them rise, we see a great many species being endangered. The bottom right is the redwood. I live in Northern California, and we have redwoods, and they gather their water all summer long when we don't get rain from the fog. And we've been seeing less fog. So redwoods are, in fact, becoming endangered because of climate change, along with a great many other things. So you may or may not have heard this litany of things that we're concerned about, those of us who are concerned about climate change. We're seeing, and I'll go into a little detail in some of these, we're seeing increased sea levels, we're seeing increased storm activities. Have any of you been in a community over the last year or two where you've had an extreme weather event, a flood, a fire, sea rise, hurricane, any of these things? Well, we're also seeing, globally, we're seeing critical shortages and changes in agriculture, and we already have areas that are incredibly vulnerable because of that. We're seeing both increased droughts in some areas and increased flooding and water events in others. Those droughts are often creating the conditions for fires, and fires that are more extended, hotter, and happening more often. And then we've had heat waves. We've had heat waves in places that don't ordinarily have heat waves, and I'll talk about what that means to us as nurses. And then there are a variety of issues around access to water. In the state of California where I live, there's a town of Porterville that has several communities that are out of water. Done. They turn the tap, nothing comes on. All of the water that they drink and use for cooking in the house has to be brought in bottled water. They have community showers now because they can't take showers in their own home. In places around the country, when we begin to see more extended droughts, we're going to see this happening in more communities. Consider what this means to the stress level of that community. What does it mean in terms of people who have mobility issues for them to actually get to showers, for instance? I mean, real practical things come up. We also know that there are a variety of diseases, which I'll get into some of them, that are associated with climate change. And then, for me, an additional heartbreaker is that we're seeing accelerated species extinction. And some of that is from many of the other things that we've been doing as men and women, and others are related directly to what's going on in climate change. The other thing we're beginning to see, and we see this after extreme heat events, we see it after extreme storms, is that people wind up being sent from their homes and having to live somewhere else, either temporarily or permanently. In places where crops are failing, we see whole parts of countries, particularly in the global south, that are shifting people around, creating many, many more international refugees as well. So, as is true for almost everything bad that happens, it happens worse in the developing countries. And so these are the populations in the global south who are going to be the most vulnerable to famine, the most vulnerable to droughts and to extreme weather events, whether they're an island culture where the sea rise is displacing them or in areas where their crops are failing. We're also seeing excessive heat. In Chicago several years back, during a heat wave, 600 people died from hypothermia or heat exhaustion. How many of you actually would know what to do if somebody came in overheated to the emergency room? Is that something that you've learned about? Would you be able to intervene in your community? Would you know what the first symptoms and signs would be? Well, as we begin to see more and more heat-related illnesses, we as nurses better be prepared to understand not just how to address the critical situation, but how can we be involved in making sure that our most vulnerable populations in the communities know what to do when there is a predicted heat period. So if they have mobility issues, if they're cognitively impaired, if they're elderly and frail, how can we make sure that they can be in a place where they will be safe from the heat? So one of the things I'm working on in San Francisco, Northern California, we don't have air conditioners in our homes. Anybody think that's crazy to not have air conditioning? Well, we don't have it because we historically haven't had these kinds of heat experiences. So in San Francisco, where they're now having these extended heat periods, they have had people die, particularly the elderly frail. And so now we're thinking about how can we use medical dollars to buy a window air conditioner for an elderly frail person? How can we use health dollars for $150 and buy a small air conditioner so that they can have that rather than wind up at some point in the ER either very sick or worse? How can we begin to think about how we'll deal with these extreme heat events? If we merely create cooling centers, how can we ensure that the homeless will wind up knowing where to go and how to get there? This is part of our role in nursing, and it's going to be increasingly our role and an important one for us in light of climate change. Fires, the bottom right photograph here, I gave a talk to the International Council of Nurses in Barcelona, Spain, in just last June. and I spoke to 5,000, a little bit larger than this group, of nurses from around the world. And Barcelona just last year had a massive fire, an urban fire. These kinds of fires haven't happened since the beginning of last century. We're seeing the conditions for both urban fires as well as forest fires. And this is another way that people are displaced from their homes, that ecosystems are challenged, and so forth. We're also seeing sea rise. Sea rise is predicted to double in the next few decades. Now, I'm kind of an old person, so I'm going to see some of this, but most of you are young people in this room. And this is really going to be part of your challenge. And I really ask you to face that challenge and to begin to understand that you have a role in preventing as well as acting on these issues. We're already seeing coastal regions that are being challenged. And it's simply phenomenal to me that they're continuing to build, for instance, in Florida, right on the coast, without really paying attention to the fact that unless we do something, sea rise is probably going to be up into their, middle of their kitchen counters at some point. When we have sea rise, when we have flooding, we have water that stays in the soil, water that stays in our homes, in our basements. Then we wind up with a variety of other health problems that come with that. So we wind up with, especially with standing water, we wind up with more mosquitoes and other vectors that can bring diseases with them. In the South, when we've had some of the flooding, we've seen increased rat populations that wind up back in the areas where the homes were. We also wind up with mold. And mold can be a trigger for people with asthma. It can trigger allergic events. People who have respiratory problems can be triggered into bronchitis and other lung problems when we've got mold in our homes. The other things that have happened from all of these storms is incredible infrastructure destruction. We've had highways, bridges, other things. So if you're a nurse, you've got to get to work. Well, what happens if the bridge is down and you've got to go another hour and a half around? And we're seeing this in various places where we've had these flooding events. It's not just an inconvenience, it also can really be a critical problem for emergency response vehicles when we've got roads out and an inability to get to people with life-threatening illnesses. We also know that particular vectors are winding up around us because of areas where there's longer and wetter seasons. We're seeing more ticks. We're seeing more ticks that are carrying Lyme disease that are in areas where we never saw them before. Malaria and dengue, which we're not seeing that much, though we do have some in the US, but we're seeing more of this in the equatorial areas and in the global south. And hantavirus, which is carried by rats, we are seeing in the southwest, we're seeing increasing numbers of that. So how many of you have learned about, who live in these areas, have learned about some of these things? Malaria right now takes about 2 million lives a year. It's huge. And if we begin to see greater areas where malaria exists, we're going to see these numbers go in the wrong direction. And for those of you who are interested in global health, and I know some of you are, this is going to be an issue that is going to be critical for those of you who go to the global south. Air pollution is going to be accelerated and extended because of global warming and because of climate change. And air pollutants can be carcinogenic, they can cause all kinds of pulmonary problems, but they also can cause a range of other things. They can cause mental stress. So we know on the days following a very high air pollution day, we see more psychiatric admissions into the emergency room and more use of psychiatric meds. And this follows air pollution days. We also are seeing changes, as I mentioned, in the oceans. Anybody here like crabs? I like crabs. Well, the year before last, we weren't able to get any crabs in California because we had red tide in. They weren't allowed to pull them out of the water. And the red tide happens increasingly now because the oceans are warming up. For many of us on the West Coast, crab is kind of a luxury item, but for the people who make their living in being crabbers, this is really an economic hardship for them. In other parts of the world, fish is the main protein that people eat. So it's really important that they be able to continue to harvest healthy fish and in abundance. There are some specific diseases that we're seeing. The last one, valley fever, this is something we're seeing in the Central Valley of California. And I have a student right now who has missed a lot of this semester because he actually has this diagnosis. This is a disease that you have forever, like malaria. It's never fully cured. It can come back. His first diagnosis and last episode was when he was in high school, and he's now 26 and had a recurrence that put him in the ICU twice this semester. So some of these diseases are significant diseases, and diseases that you all will probably be seeing if you work in emergency rooms or even primary care, and certainly in acute care settings. Once again, our most vulnerable populations are going to be the ones that are most impacted. And as nurses, we always think about the most vulnerable. They're the ones that we're always trying to figure out how can we make sure that they're not left behind, that the special needs that they have, we can deliver. And they're children, the elderly, people with cognitive and physical disabilities, people with a range of existing chronic diseases, and migrants and immigrants. And I think I'd like to add one more specific here, which is farm workers. These extreme health events, or heat events, I should say, extreme weather events, some of you have experienced them personally, others of you have certainly been watching them on television. And so I'd like to talk about my personal experience with two of them, actually. So we're beginning to see, as I said, these climate refugees. Sometimes they're short-term and can go back to their homes, and sometimes they are semi-permanently, meaning for several years, or more permanently displaced people. Do any of you recognize this scene? I know some of you are young, but this is actually not a scene from a third world country. These were scenes from when Katrina, the extreme weather event, hurricane, happened off the Gulf Coast. And when this happened, it was so significant that the governors of the southern states called the governors of the northern states and said, we need some help. So the governor of Mississippi, I was on the faculty at the University of Maryland, the governor of Mississippi called our governor at Maryland and said, we need you to send doctors and nurses and others down here because we're in really big trouble. So an email went out and asked if people would volunteer, and I was not a disaster relief expert, but I was up to helping people. And so this happened the day after Katrina hit. We had what was called a well-mobile. These are like these big bookmobiles where we did primary care on the Eastern Shore in Maryland. We had 8 nurses, 2 drivers, one faculty member who was responsible for these well-mobiles when they were just doing primary care. We didn't know what we were getting into at all. We packed a bunch of camping equipment. We packed big coolers with food, and we got on the highway and we went to Mississippi. When we got there, there were people. The 2 little towns we were asked to serve were inland because they were not sending Red Cross people or other volunteers into the flooded area. That would put us at risk, and it wouldn't necessarily help the people that were in trouble. So we got as far as these 2 little towns, and massive numbers of people were in small cars and trucks and the backs of pickups. They had their precious few things. They were literally sometimes pulling over the side of the road because there was an old barn there or an old shed, and literally stopping their cars. They had no money for more gas. They didn't have resources. They left in a hurry, and they were just seeking shelter from the elements and just getting themselves settled to figure out what they were going to do next. So what happened in just a 2-3 day period were these two towns that I was in. One was Macomb, Mississippi. The other was Brookhaven. Their base population, as you can see on this slide, were a little over 12,000 and almost 10,000, 9,800. Overnight, these populations, these small towns, surged to 23,000 and 20,000. So I want you to just think about that. When that many people come to an area, how many Tampax do you need? How many Pampers do you need? And those are things you need now, right? That's not something you can wait till later. How about water? Where are we going to feed them? How are we going to shelter them? Once again, most of us that came down with those wellmobiles, we were not real expert in this. But very quickly, we discovered there were a few people on the ground already, and they were often the Red Cross folks that were from the local area. And here's the beauty of the South that I wouldn't have known because I've always been either from New York or California. Churches are big here, really big. And I didn't realize that. And what a blessing that we had these really big churches, because they immediately opened their doors to these storm refugees, to these climate refugees. And so one of the things that you will learn if you get interested in disaster preparation and planning is that usually it's the state agency somewhere that's got cots. Red Cross has some, but state agencies deploy them. We got cots, and it didn't take long after we got cots that we got cots filled. And so these cots were in the churches that we were able, I don't want to use the word commandeer because that sounds like we hit them over the head and took over. They opened their doors. We were in the churches. They almost all had these like industrial strength kitchens. They had multiple bathrooms. Many of them had showers in them. So we started to register people, get them into cots, get them settled. Initially, we had community volunteers that were helping to make meals, and we went with our wellmobiles from church to church between those two towns, and just were making sure that the critical needs of people were being taken care of. And if they had emergencies, that we got them to an emergency room or other kind of healthcare setting. Consider this. What do you do with people who are on dialysis, who had to flee, are nowhere near their dialysis center? How do you get them rehooked up? These are the things that we as nurses have to be thinking about, or people who have other events that they have to do regularly, people who are in the middle of chemotherapy. What are we doing with those folks when they've gotten evacuated because their whole community is underwater? So there were a lot of people who looked like deer in the headlights. They just didn't know which way to go or what to do. And we started taking care of them. And then piles of Red Cross volunteers came in these ERVs, emergency response vehicles, from all over the country. A lot of them are older and retired because they can go on a dime. But for any of you who have the capacity and flexibility, volunteer with the Red Cross. You can be deployed locally, you can turn down a deployment, but your skills and your capacity would be really well suited for coming to and responding to events like that. They were my teachers and mentors for the weeks that I was down there. So the next thing that started happening is we did commandeer a couple of warehouses. Once again, we needed a lot of Pampers. We needed Tampax. We needed children's pajamas. We needed food. So many food companies sent these huge semi-trucks that were refrigerated with chickens in them and other kinds of proteins. We got other sources from large grocery store chains, from Walmart. Walmart was great because about a week into it, we hadn't taken showers, the nurses I was with. And it's really hot down there, and we were getting a little bit stinky. And so Walmart helped us to create, they gave us polyurethane and 2x4s and some volunteers, and we were able to hook a hose up to a house way over there, and we created these really nice shower stalls. So I'm forever indebted to Walmart for that. And we got cold showers, which were delightful at that point in time. But we also filled these warehouses with all kinds of essentials for the people we were serving. Once again, I want you to think about, we had 20,000 people we were taking care of. Think of a town of 20,000. People have the flu. People have maybe a fever. People have cognitive impairment. People have chronic diseases. People have mental health issues. Everybody had some mental health issue, given what had happened, right? But some people actually have psychiatric diagnoses that are really going to be thrown into a flurry when these kinds of events happen. Women just had babies. We had day-old, 2-day-old babies. Women were about to have babies. So what we did was we set up a whole separate church gymnasium that was just for women who had just had babies or about to have babies. No men were allowed in there. Men could meet with the women. They could bring them out. But this was a safe haven for these women to care for their newborns and to care for themselves when they were about to have a baby. We did not deliver babies there. We got them to the hospital, but this was a safe haven for them. And when people were exhibiting extreme psychiatric symptoms, we culled them from the herd. We got them to safer places so that they would be safe and feel safe, and that would also help everybody else feel safe. Because the worst thing you want in an event when everybody's really stressed out is to have somebody who's having a psychiatric event in the middle of that. So there were lots of ways in which we had to sort of slice and dice the population and take care of them in the same way that we regularly take care of people when there is not a huge extreme weather event. And then many of the people wanted to go home. They wanted to see what their home looked like, what kind of shape it was in. We got a message to all of the people that were doing relief work that people who were going back to the shores and back to their homes had to get tetanus shots. So, this was from the CDC, this memo, so of course we thought we should really listen to this. So we went to the local health department. We've got 20,000 people, right, that we're caring for. They had 3 doses of tetanus. So part of our preparation is really understanding what we need to prepare for and how we can make sure we can mobilize meds, we can mobilize equipment, we can mobilize at a moment's notice, or at least at a quick notice, what we're going to need to take care of people who are well but displaced, and people who are not entirely well and displaced. The biggest issue we were taking care of is people didn't have their meds. So people who were insulin-dependent diabetics didn't have their insulin. People who had hypertension didn't have their antihypertensive meds. People who had psychiatric problems didn't have their psych meds. So we were writing a lot of prescriptions. We had 2 NPs with us. And we took the prescriptions to Walmart, and Walmart filled them without any questions, without payment, and we were able to make sure that people got their immediate med needs met. But this is an important one. I just want to ask, how many of you have a go bag? So if some event happens in your area, I see a hand going up here, These are, your little backpacks that have your important papers, meds if you need them, an extra pair of shoes, a flashlight. These really, really basic important things that you could grab and go with. So this is part of our personal preparation for events like this. Then finally, after 2 weeks, FEMA showed up, and the Federal Emergency Management Agency, and they were starting to give out FEMA checks so that the people that were there, those who had cars, those who had some place to go, began to move out. But in many of our communities, your whole family lives in the community that's impacted. There's not another place to go. And so the level of stress for the people that remained because they had no place to go really increased. And so working with these communities, helping them be replaced into another area, part of a greater set of activities that not just nurses, but a great many of other people and volunteers were involved in. And for many, for instance, those people from New Orleans that got displaced to Houston, they permanently now live there. They never went back home. In some of their communities, they still have not rehabbed the communities fully so that they could go back. So we're having this migration. So when I say closer to home, I live in Sonoma County in California. The day of the big fires there, my home was on a compulsory evacuation. And so this is when you realize that you don't have your go bag. This is when you think, okay, what's important? The dogs, my husband, and me. Maybe not in that order, although some days. So we also have an RV, and we thought, okay, well, that's what we're going in. So we filled that up, and we went through the little town that we live in, and people were crazed. So there was a huge traffic jam of people trying to get gasoline at the gas station, and we couldn't leave in the one road of egress from our community. And the fires were due east of us, and we were trying to get west. We learned from this, and I did a bunch of debriefing with our local health department and emergency managers afterwards, that we need people immediately helping to direct traffic if you've evacuated a small community and there's one road of egress. Fortunately for us, the winds shifted. It was unfortunate for a lot of other people, so our home was not damaged. But this is another really interesting experiment. When we knew we had a little more time because we weren't sure where the fires were and we were watching them, and we were tethered to our iPhones for the emergency, we were tethered to the local radio station, which was trying to keep up with the fires as quickly as they could. So then you start thinking, what else will I take now that I have maybe an hour? Well, think about that. What else would you take, right? So I'm busy. I'm taking all my girls are now in their 30s, but I have a lot of their artwork, and I'm taking their artwork, and then I'm like, well, I'll take my favorite scarves, right? You're not thinking right? So I'm going there, and I'm going to take my favorite scarves, and, so you're just being kind of not your smartest when some of this happens, and I'm a reasonably smart person. Can't imagine. We had several friends. One of our friends woke up in the middle of the night. Sharon and Walter are their names. Sharon elbowed her husband and said, how come the lights are on outside there? And he's like, we don't have lights outside there. She opened the curtains. The flames on the hill were right outside her house. They grabbed their dog and each other, got in the car, got out of there, completely destroyed their home, their other car, all the outbuildings. And what we saw happening, just within an 8-hour period was massive emergency evacuations of homes in the hills, and then evacuations of whole communities that were in the suburban and urban areas. It was something that we've never experienced, and the winds were what really made it bad. I want to show you this. 2 whole hospitals in the middle of the night evacuated completely. Kaiser Hospital, Sutter Hospital. Now, I worked at San Francisco General when we moved all the patients from the old hospital to the new hospital. It was incredibly orchestrated. I worked in the ICU. We knew how we were going to transport these patients who were on ventilators, who had multiple devices, chest tubes, et cetera, But every single patient in the hospital had to be evacuated, and within a moment's notice. People were flying down the roads with the flames behind their backs. These are my nursing colleagues. In the process of actually interviewing some of the nurses right now for lessons learned about this event. This is the woman on the right is a hero. This was a picture of her afterwards. She was evacuating patients in her hospital at Kaiser while her home burned to the ground. So these kinds of events are the events that the fires, the floods, the extreme storms, these are all part of climate change. And so I want you to begin to think about what are the ways that we can be prepared, what are the ways that we can do some mitigation. Droughts, extreme weather, heat, fires, floods, and then mudslides. So these are the events that we need to be prepared for and that we can actually work on to help prevent. So what must we do? Well, first we got to get busy. And we need to talk about climate change. If you come from a community where there are climate deniers, we need to bring our trusted nurses' voice. We need to bring the science. We need to talk respectfully. We need to argue respectfully, and we need to help people understand it's real. And I saw this little sign, busy is the new happy. That's what we have to be with regard to climate change. So what can we do? Well, first we can do things at home. You can remember those gases that I talked about. Well, those carbon dioxide gases are created by a myriad things that we do in our homes, in our institutions, in our industries, in agriculture. In our homes, there are carbon footprint calculators where you can actually put in what kinds of activities you do, products you use in your homes. EPA has one, several environmentalist organizations have them, so you can assess what your carbon footprint is and think about ways that you can make some changes, conserve your energy, choose renewable energy sources. There are many options for those around the country right now. Eliminate plastics. Now, what has that got to do with climate change? Plastics are petrochemicals. They're derived from oil. When we extract oil, we are taking carbon out from the earth. As we're bringing it out, we're using it in a myriad of ways that are creating carbon dioxide, that are these greenhouse gases. So plastics are being connected to climate change because of their life cycle of how they're created and how we then use them. Green your transportation, bike, commute with fellow nurses and others from your hospitals. Use public transportation. Use a hybrid or electric vehicle. Other ways and gradations of changing your own transportation. You can engage your community organizations. Some of you are in faith-based organizations. Work with them to talk about climate change, to talk about conservation, to talk about disaster preparation. Planning ahead, helping communities be resilient is going to make the biggest difference in how we're addressing climate change. Working together can also help us from the fear factor of the unknown that we're hearing about climate change. It can help us be more prepared, more educated, working more as a community. Growing green, working with communities to have more green space, which helps people's mental health, decreases, when you have tree canopy, it decreases your UV exposure, decreases, therefore, skin cancer risks. It just makes a place a whole lot more pleasant. But then also community gardens, community vegetable gardens, all of these things help to create more resiliency in your communities, but also make them just generally healthier and nicer communities. If you are already working in a health system, many health systems are moving towards choosing clean energy sources because we're 24-hour workplaces. We use a lot of energy, so really moving in those directions. Volunteer. Volunteer with the American Red Cross. There are also community emergency response teams and programs in every community in the United States. They'd love, especially some of you are going to graduate soon. You won't have to be studying all the time. Thank God, right? And so now's your time to think, what am I going to do with all that time I would have otherwise been studying, right? So now you can be a volunteer. In your work setting, join your hospital sustainability team or the green team. If they don't have one, help to start one. Nurses have been starting them all over the country. Green your immediate work setting first. Support workplace educational efforts as well as competitions for who can green things more. Host a green meeting. Make sure that when you're doing your meetings, you're doing no waste, you're not having plastic bottles of water, you're kind of walking your talk. You're really doing things in a way that's thoughtful and conscious at all levels. These are just some photos of some of the green teams that I've worked with. Absolutely wonderful. And look, they're having fun. It's not sad being on a green team. They actually have quite a bit of fun. These are some of the things that the nurses and the green teams have done. The top left is a group of nurses and other health professionals who started the farmers market at their hospital. It's an inner city hospital in Baltimore City that was a food desert that now has a farmer's market during the growing season. In the bottom one is a hospital that helped to support a community garden. And the top is a rooftop garden in a hospital. I'm not going to go into the details now, but growing meat is a pretty intensive process and can create a lot more greenhouse gases than we'd like. So your hospital, the University of California, San Francisco Hospital, has meatless Mondays. Their entire menu for on Mondays for breakfast, lunch, and dinner is meatless. It's a good way to get people to see that there are other ways to eat besides having meat at every meal. And also you can help your patients in the community understand why you're doing that. Work with your nursing organizations. Obviously, you are already ahead of the curve. Here you are with your Nursing Student Association. But also, many of you are going to be in a nursing specialty. Maybe the Association of Operating Room Nurses, maybe the public health nurses, maybe emergency room nurses. They all have associations. Work with them. They all have annual meetings. Ask that climate change be put on their annual meeting program. Think about how you can evolve your own leadership in working in these areas. So I want to just show you one example. Do most of you know what blue wrap is? In some instances, it's a green wrap. So this is used to wrap the sterile materials in operating rooms and in other kinds of specialty centers. It's polypropylene. This is plastic. So one of the nurses at the hospitals where I worked years ago, they would take all of this sterile plastic and put it in the red bag. Well, that was the wrong bag in any event. And then they said, okay, well, we'll just put it in the regular trash. But they were realizing that they were just creating this huge amount of trash. So they worked with some companies to have them collect the blue wrap, and then they were making post-consumer products. They were making mats, floor mats out of the blue wrap. But they were still then having to buy blue wrap and at least they were using it again. So this was a success, though, and they felt like they were able to close a loop. So what do you do when you have successes? You celebrate, right? So they had a blue wrap fashion show, and so they got busy with creating the highest of fashions out of the blue wrap. But then they really began to think, okay, do we really need the blue wrap? And this is what they are now using in the forward-thinking operating rooms and other kinds of treatment rooms like cath labs and other places like that. They're actually using these cases. So they clean the instruments in central supply, and then they put them in these metal boxes, and then they sterilize the whole box. So they don't have to wrap them in blue wrap. They sterilize them in these boxes. Blue wrap gone. It's just a way of and it was a nurse working with a company that came up with this idea, and now it's really happening in lots of operating rooms. The Alliance of Nurses for Healthy Environments is the organization that I helped to create. For those of you who are interested in climate change or anything else having to do with the environment and we're all nurses who work in other settings, but who are interested in environment and health. And we really would welcome you to come and hear a little bit more about what we're up to. We have a website. It's envirn.org. We also have a climate change work group, and we have people from all over the world, nurses from all over the world, who are on the monthly calls to talk about what's going on in this area. We work on educating nurses, educating faculty, as well as nurses who are out there working. We work on greening our clinical practice so that we better understand the relationship of the environment to human health and how we can do environmental health assessments, anticipatory guidance. We also work on research, so we've got PhD nurses, and we do advocacy. So we wind up advocating for human and ecological health. This is our planet. This is actually a photograph taken by NASA from outer space. It's just extraordinary, I think. This is home. We don't have another one. This is it. So we really need to be taking care of it. And my plea to you is that you'll be part of taking care of it, that you'll work at home, you'll work locally in your communities, you'll work within the institutions that you're about to go and work in. Those of you who are interested will work with your national nursing organizations, your specialty organizations, perhaps regionally. And then for those that are interested, we can certainly work on a global level. Busy is the new happy. And I want to thank you for coming to this session, and I hope you'll have a little better idea how to talk about climate change and how to recognize that it really has to do with nursing. It really does. And nursing has to do with mitigation, prevention, education, and being prepared. So thank you very much. Thank you. So we have some time now for questions, and they have set up mics. I would really welcome you to come to the mics if you have questions now.
There's a course that many of us take, like community health, where we learn about disaster preparedness. And I remember when the hurricane which hit in Texas,
Yeah.
A lot of nursing students wanted to go down there, senior nursing students wanted to go down there and help out. But we couldn't because I was trying to set that up and there was a lot of pushback. And I was thinking, what can we do as nursing students to get active in the community when something like that happens? Oftentimes we may not have the money, but we have the service and we really want to help.
Sure, that's an excellent question. And what you have to do is get active before the extreme weather event. So for instance, when When any of the big hurricanes have happened and people in the North Sea, and by north I mean just north of where the hurricanes are, see this and they're health professionals, they want to go in there and help. You can't just put your stethoscope around your neck and just arrive there. You're not in a system. So you need to be in a system, because then they already have checked your credentials, they know who you are, they know what you're capable of, and then you will be deployed within a system. So that's why I'm recommending that you all get connected to a system, either your local emergency preparedness organizations. You can call your county health department and find out who that is, or the American Red Cross. It doesn't mean they're going to be calling you every 2 days and deploying you, but what it means is that you will already be in a system. That way, when the Red Cross is deploying people to a hurricane or to somebody's fire in their home, you will get a call and be asked to deploy. Now not only are you in a system, but you have probably received some training from them, so you know what your role in that system will be. And that's going to be really important. So you would never go to a hospital, right, and just walk in the door and say, all right, I'm ready. Right?
Yes.
So you need to be in that emergency response system. And it's not a lot of work, and it doesn't mean that you're going to be deployed all over the universe. You tell them, I can go to this geographic area. They also will then help with transporting you.
Thank you.
Sure.
So my biggest question is, just because I don't have a go bag, and I can imagine that probably more than 50% of the students here don't have a go bag. So what would be your top, say, like 5 or 6 things that we have to have, other than vital documents? I think we all know vital documents. Other than that, to have in our go bag.
So some of this depends on where you live. So if you live in an area, you want to have weather-appropriate clothes. So having rain gear, having layers, particularly if you're in an area where it's going to be cold at night, is going to be important. Flashlight, really important. Shoes, extra pair of shoes or sneakers, something that you can have on your feet, really important. Radio, batteries, backup batteries for any of your devices, communication devices. But that's off the top of my head. If you just Google go bags, you'll find a really nice list of the things that you can put in there. If you put also documents, for those of you, most of your nursing students probably not going to have the really important documents. But I know you said that we need the documents, but this really helps you understand what documents. The other thing to note, take photographs of your home. Outside, insides, all your rooms, all your furniture, etc. Because this was a huge issue for the fires. They're going to be getting insurance to pay for their homes. A lot of them won't have enough money to replace their homes. But they had to document every single thing. Their mix master, or their, KitchenAid, they had to have a picture of their KitchenAid in order for their insurance money to pay for their KitchenAid. So take photographs of your stuff and put it to the cloud so that you have it. I hope that was helpful. Yeah.
Oh, yes. Hi, good morning, Dr. Sattler. Diane Mancino here.
Hello.
It's great to see you. I'm the executive director of the National Student Nurses Association, and I really loved the example of the blue wrap. Many of the students who are here today were at a session yesterday on innovation, ingenuity, and I think that's probably one of the most important places we can go with this, because there's so much that we are using and utilizing that we can innovate around. And you have great opportunities to do that in your new jobs when you graduate, as well as in your communities and in your homes. And I have a confession. I'm addicted to Ziploc bags. I'm a little ashamed of that, but I am coming out of that addiction. I discovered that there is a Ziploc recyclable bag that I can wash in my dishwasher, and I am coming off of that addiction. because because if any of you have seen these incredible photographs of the plastic islands that we are creating in the ocean, you'll know that this is a very serious problem. I'm trying to figure out how to get my dry cleaner to stop wrapping things in plastic and to go to paper. So these are the kinds of things that we can do as individuals as well as to innovate around when we get to our hospitals, because there's huge amounts of waste in hospitals. So thank you so much. We really appreciate you being here.
Sure. Thank you, and thank you for having me here. Before I go to the next speaker, I'd like to encourage those of you in the room to go to the website noharm.org. This is the website of Healthcare Without Harm, which is a now international organization that works on greening our hospitals. And they have lots of different ways that you as nurses can be engaged in helping to make changes, sustainable, climate-friendly changes, and it's noharm.org. Yeah.
Good morning. Thank you for your time, for coming out here, first off. My biggest question, I guess, would be moving away from using the polypropylene, was that the right word? And using machine steel or aluminum cases. My biggest concern is what's the carbon footprint of making not only a ton of these cases to have, because we have to have enough in an ICU all across the country, and then what is the carbon footprint of then autoclaving these things to make sure they're sterile for the next procedure? I just feel like maybe that could be a concern.
Yeah, and you know, these questions come up. So what I can tell you that we do know is the return on investment for them is about a year and a half. So that's from the bottom line of the hospital. In terms of steel, it lasts forever. Anybody here ever use a stainless steel bedpan? So if you're an old fart like me, you did. But if you're a young nurse, you've probably used plastic bedpans. And then what do you do with them when the patient goes? You either toss them or you give them to the patient, right? So even Martha Stewart probably has some problems coming up with a good thing to do with an old plastic bedpan, right? So stainless steel was what we used, and we could use it forever. And you can sterilize stainless steel and then use it on the next patient, et cetera. So I think that if somebody were to do the life cycle analysis, which as far as I know they haven't, that in the long term, it's probably going to be better to use that steel box, use the autoclave, rather than repeatedly extract oil out of the ground, make a new plastic, transport it to a place where it's then manufactured into blue wrap, transport it to the hospital, use it in the hospital, then put it in a bin for recycle, transport it to a place where then it is made into a new product. I think if you start doing the life cycle analysis of both of those, we'd probably find out that it's better to use those steel cases. But I'm just conjecturing. The science isn't there yet. And it would be a good project. Yeah.
Thank you for the presentation. My question is twofold. Unfortunately, we've been seeing that the topic of climate change is becoming very political. What is your organization doing to advance the topic in the government, if at all anything is being done? And also, what would be your advice or recommendation of how we engage our fellow peers with the topic of climate change as it relates to nursing?
Thank you for both those questions. So, and it gives me an opportunity to talk about a couple of things that I left out. So when a year and a half ago, maybe 2 years ago, 20 nursing leaders, including, fortunately, myself, I was blessed to be able to go, we went to the White House in the United States. Now, this was before President Trump, who is a climate denier, but we went to the White House under President Obama, and we had nursing leaders from 20 different nursing organizations talking with the climate change chief of staff for the White House, as well as other White House experts and people from the EPA. And we talked with them about our interest in engaging collaboratively with the government on climate change. We now have a cooperative agreement with the Environmental Protection Agency as nurses to continue to work in that direction. We are working regularly at sending messages to Congress, to the EPA, and to the President on these issues. We are working with in our own districts on the same thing. On an international level, the International Council of Nurses last year and the Alliance of Nurses for Healthy Environments, the organization I'm working with, we drafted a policy statement for the International Council of Nurses that has now gone through 134 national nursing associations and been signed on to, basically calling for nurses around the world to work with their governments on mitigating and addressing and then responding to climate change. So nurses are involved in this at a lot of different levels already. Thank you for your question. And we need to talk, once again, we need to talk respectfully to those folks who are climate deniers. Fortunately, the vast majority of people in this country think climate change is real. Let me repeat that. The vast majority of people in this country think that climate change is real. So we have a vociferous set of climate deniers, and I always ask my students, in whose interest is it for them to remain climate deniers? If we help to clean up our water and conserve energy and therefore not pollute and use coal-fired power plants anymore that create all kinds of cancers and lung disease, et cetera, if we do all of these good things and you still don't believe in climate change, well, we've done all these good things, right? So I'm not going to spend a lot of time with the climate deniers, but respectively talk with them. Yeah, I have somebody at the mic over here.
As a new graduate getting ready to go out into the field, how do you recommend that our voices be heard? I know, we can get involved in leadership boards within our hospitals, but as a new grad, what can we do when we see changes that we want to make?
Sure. Well, first, settle in. Find out where the bathroom is, Get on your feet. I think that's really, really important. Learn who your colleagues are. Learn who else already is kind of leaning into this. Those are going to be your buddies. See if there is a green team at your hospital. They're going to be your buddies. And if, by any chance, you haven't found your buddies there, come to us, the Alliance of Nurses for Healthy Environments. We are definitely your buddies. And we'll also help to connect you with other nurses in your area and your region. So nurses have done things like grand rounds, nursing grand rounds at hospitals, bringing in speakers who help to educate their fellow nurses on issues there. Working with the educator for you. Every hospital, every major hospital has got a full-time person responsible for educating the staff and nurses there. So talk with them about bringing programs in around these issues. But come and speak to Kara or I afterwards, and we'd be happy to, connect the dots for you. Sure. Okay, you can go now.
Hi. First, I wanted to thank you so much for your talk. And so my question is, for countries in other parts of the world, are they doing, do they have strategies that you think the U.S. should adopt for implementing climate change and health practice?
Yeah, so a lot of the European hospitals are ahead of us, and some of the European countries are ahead of the U.S. We need to be learning from them. I think that we've been doing some good things here. We've been accelerating our use of renewables, for instance, and we also, other countries that recognize and are accelerating their need for changes, China now is really making some major changes, and the way China can do this is it's a centrally controlled, centrally governed country. It's a huge country with a huge population, but they can accelerate their changes. And their air pollution because their air pollution got so dreadfully bad, they realized that they had to make some changes, and so they've been doing that. At the hospital level, I can't give you more information there. They're still manufacturing mercury fever thermometers, for instance, and we don't need those anymore. So there are some pluses and minuses. India is another huge country where Healthcare Without Harm, the organization that I mentioned, has an office there, and we're trying to do some work there. But in some of these other countries, they don't have the kind of industrialization that we have in the US and in Europe and some of the other industrialized countries. And they can leapfrog over that, so they can go straight to renewables, and including solar and other things. And in fact, we'll have, in some ways, an easier job at that. But internationally, there's an organization, for those of you who are interested, once again, in global. It's called the Global Green and Healthy Hospitals. Global Green and Healthy Hospitals. They've got offices all over the world, and they're helping hospitals in the developing, the global south, developing countries, as well as the European countries and in the US. I so appreciate you coming to this session, so thank you very much.
We did